these tiny little eyeglasses right here? By having your young child get an eye exam early in life, you might be able to avoid them having to wear glasses for the rest of their life. I want you to meet Dr. Gadir Makushi. She is a pediatric optometrist here at Nationwide Vision. Explain to everybody at home, what exactly is a pediatric optometrist?
A pediatric optometrist is an optometrist or eye doctor that specializes in pediatrics. They have advanced training, both the expertise and the experience to work with children of all ages. And as you can imagine, an exam for kids is very different than for adults. So it requires a few different tests. We put some drops, some lights, and so a pediatric optometrist is going to be the best choice for doing the exams for your little ones.
Okay, but you know, when we take our little ones to the doctor, we take them very often when they're babies. Aren't they already being examined for their eyes from the pediatrician?
Unfortunately, screenings at both the pediatrician and the schools are not comprehensive exams. And they give parents kind of a false sense of security because they're not testing some of the big issues. They're not checking health of the eyes. They're also not doing those screenings at near. So what we tend to catch is just kids struggling with distance. And we're missing those kids that are struggling with learning, that have other vision issues that cause some real concerns with learning and development.
Okay, so really at what age should we begin eye exams for our children?
We like to have that first exam between 2 to 3 years old.
Oh wow, okay.
So you want to think about younger kids that are at risk, those that were born early, that are premature, or you have a family condition of lazy eye, as many people know it, or an eye turn. You want to bring those kids in a little sooner. We like to see them at 6 months and rule out any big concerns.
How do you do an exam at 6 months old? I know how difficult it is trying to get them in the chair at the dentist, so you're an angel, I can tell you that already.
So doing an exam on kids is a little different, but really a lot of parents are worried about, you know, their kid can't speak or how are they going to cooperate during the test. But we put some dilating drops, those are some eye drops to open up the pupil of the eye, and just based on that we can check with some lights how the health of the eye is developing, make sure everything is on track, and whether they are overly farsighted or nearsighted for their age, because we don't want to stunt the normal development.
Okay, so for infants, is that a different eye exam? I mean, clearly they can't tell you, you know, what they're seeing or what they're not seeing. So what are you looking for with infants?
So we're not asking children what's better, 1 or 2. Parents are always worried about that. We don't even need the child to speak, really. They're able to sit there, and once those drops go in, and it's a combination of drops that open the pupil and relax the eye, so we can take measurements to see, are they in need of glasses? Do they have any health concerns? It's actually, for most kids, a fun exam other than the drops.
Okay, all right. And mom or dad can be there, right?
Absolutely. We encourage it. We like the little ones, the younger they are, to sit with mom or dad. We'll usually do some of the tests on mom first, so that the kid can see it and won't be as scared or nervous about what's going to come.
You know, and I'm sure it's just like any other exam, you know, getting them comfortable and started off in the right foot will really help for future exams.
Absolutely, absolutely. You know, really our main focus is that amblyopia, what a lot of parents know as lazy eye, is the leading cause of vision loss and blindness in children. And it's 100% preventable if we can catch it early. That means at 2 to 3 years old, if we're doing those exams, if we find those issues, it is treatable.
All right, well, we are trying to avoid little tiny glasses like this, but the good news is that if they need little glasses, you have a whole bunch of them right here that make them look fabulous, no matter how old they are.
Absolutely.
All right, good information. Thank you so much, doctor.
Thank you.
And don't hesitate, parents. Here's how to make your appointment for your little one right now. And here's how you make that appointment with a Nationwide Vision pediatric optometrist for your child. Here's the number to call. It's easy to remember, 1-800-EYE-CARE. And you can learn more. They have several locations for you to choose from. All you have to do is visit their website, nationwidevision.com.